Good afternoon and welcome back again. Now we have a panel under the title of Regulating the Relationship Between the Physician and Pharmaceutical Companies. The panelist is Ranj Karim Ali. Please welcome on stage. He will start with a presentation and followed by an open discussion. So please, if you have any questions, you can raise your questions. Christina will be assisting you after the presentation. Thank you.
Hello everyone. My name is Ranj Karim Ali. I have a background in pharmacy and currently I am the patient services manager at Media Diagnostic Center. I also am the sales manager at a pharmaceutical company, Argentinian pharmaceutical company. The name is Ilia. I have had several years of experience actually in this field, and there are a lot of points that need to be discussed. It is a very interesting topic because many people like to talk about it. However, very few people actually understand what's going on. If I actually get a few answers about what you think is going on between doctors and physicians. Do we have mics now? Okay. Based on what you have heard from the media, from people talking about it, from patients complaining, there are a lot of complaints about patient exploitation, about the ethical side of this subject. But based on what you have heard, is there any ideas in the room about what is actually going on in the market?
I would like to welcome you warmly.
Oh, thank you.
And regarding what you asked, what we think is going on, what our idea is, what do you mean exactly?
Okay, so people really have a hard time comprehending what's going on. They say doctors are getting paid to prescribe. They say doctors are getting sponsored. What is your take on all of this?
Personally, as a fellow to you who also works in the pharmaceutical market, there is a certain aspect of that is true. I'm sure, as you may know, since there are what's called deals in the pharmaceutical market in which doctors are getting paid to prescribe some medicines. But from what I see and my experiences, not all physicians practice in this way.
Okay.
So it is a corrupt business, and there doesn't seem to be a regulating body regulating doctors from what they prescribe or how they prescribe their medications. That's how I see it.
I mean, that is for the most part true. But in order to understand what's actually going on, we need to analyze the root cause of the problems. Actually, in order to understand it, a simple way would be comparing a simple product to medicine. So for example, let's choose milk, let's say. Milk is sold directly to the customer. So you as the customer, you go into a supermarket, you want to buy milk. And you know what you will buy. Is it low fat? Is there no fat? Is it full fat? You know what milk will do for you. You will have it with breakfast. You will have it with your oatmeal. You have the choices. You know what will happen. For medicine, you are the customer, but you are not the decision maker of buying, which means somebody else will have to do the decision for you. And in that case, we are left with the factors that will affect that decision. What are the major factors? Well, we have cost, we have affiliation, we have personal interest in the matter. A lot of doctors have personal interest in the matter. Now, what are the interests that a doctor might have in prescribing a medication? Any ideas? Yeah, sure. Please.
So a lot of factors, including the brand of the he's prescribing and whether a medical representative have visited him,
Okay.
and whether the doctor has tried and has a feedback about the product already. And in some circumstances, it could be the deals, the promotions that are provided to the doctor.
Okay.
Unfortunately,
By the way, how many physicians do we have in the room?
almost a physician.
Okay. So we have a bunch of physicians. If I could please hear from the physicians, what are the factors that make you decide what to prescribe? We have a...
Maybe the quality of the drug. Definitely, if the drug is from a well-known pharmaceutical company, and the price, if it is reasonable or not, and I can discuss this with the patient, because some patients, they cannot pay and consider for 7,000 dinars as a very expensive drug, while others consider it very cheap. So I have to discuss this with the patient, and of course, I can prescribe him a drug with a reasonable price and of good quality.
Doctor, if I may ask, how do you choose which has good quality and which doesn't?
Well, you know, there are, I can search the literature, maybe there are studies based on, made without conflict of interest, they are of high standard studies, and maybe some of these studies are delivered by the drug company itself to me through their people or representatives.
Okay, thank you very much. Can I hear actually another perspective from a different doctor?
Thank you very much. As a psychiatrist, most of our drugs are relatively expensive. Personally, it's one of the biggest struggles for me to identify a specific company and specific drug that works, because it's not easy for me to say if, as a person, this patient received good treatment, he has a good compliance, he or she took the medications regularly. It's not my job as a doctor to follow up the good quality. It makes my job much more difficult. So it has to be regulated by some areas. Who is, for example, drug X is a brand. Is it really a brand or just came and smuggled in Turkey, Iran, or Syria? So it's hardly difficult for me. That's why most of the times I'm stick with one or two choices of drug, that even when some other colleagues from representative from the company say, doctor, we have this kind of new drug, I'm really hesitate to try, because I have experience with the other pharmaceutical companies, but not the new ones. Probably the new ones are better, but I'm specifically afraid to try it. And as the doctor mentioned, the price for me is something, but I really do push for the limit that this guy, this patient, this individual try his or her best to get the best quality, because otherwise probably he or should end up taking some kind of what we could say jets or anything, and the response rate will be very, very low. So personally for me it's very difficult. I cannot say I have decided, but I will stick with the old-fashioned tried by other psychiatrists, and I'm really avoiding trying new ones.
Okay. Well, that is a very good answer, actually. Many doctors do not actually know what the quality of the product is, and they actually have to try it on patients in order to know. Now, if the system is regulated, we do not need that. If the system is regulated, you can try the drugs and you can trust that this drug will work. Actually, if we could just hear from one of the two doctors behind. You had your hand up? Yes, please.
So I am cardiologist. So first of all, I care about the efficacy, and then the monthly cost, and if the patient is going to take this treatment for a long time, so I care about the monthly cost.
Okay.
If I'm gonna try a new medication, I usually make a deal with the representative. Can you give me medications for a month? I can try it with one patient at least, and if I found it efficient, I can then prescribe it if it's a new medication. Plus the side effects, I care about side effects or drug-drug interactions. So these are some of the factors that affect if I'm gonna try or use this medication or not.
Okay. So I'm sure the physicians in this room, they do not overprescribe. But do you know any physician who overprescribes medication? You're sure that the patient does not need so much medication and they're overprescribing. Can I see a raise of hands of if you know somebody or a doctor who is overprescribing in Kurdistan? Okay. Now, what do you think the reason is? Because since the doctor wants to treat the patient, they should prescribe the normal amount. Well, the thing is, there are multiple factors. So, for example, a doctor might believe an article that they read. Now, is this article in the guidelines? Probably not. A doctor also might prescribe from experience, or a doctor might be sponsored to prescribe. Now, these are all different issues, and we have every one of these issues. The last one, the one who gets sponsored, the ethical dilemma starts here, because many people would not want to be the person who is the patient, and you're getting prescribed a medication that's not needed. However, you as the patient, you cannot possibly know whether the doctor made the right choice or not. So, how can we actually assure that the doctor made the right choice? Because right now, no one knows what each doctor is doing inside his or her clinic. What are some ideas? What are the ways that we can prevent maybe overprescription or playing with the patient's disease and actually prescribing the correct medication and the normal amount of medication? Any ideas? Oh, yes, please.
Thank you. As we know, there are some cases cannot be treated with the only one type of drug. Some indication are actually need for the polypharmacy. So sometimes the physician he must prescribe more than 2 or 3 types of drugs. So what he should do? This is the indication. It should be followed the sometimes guideline, as you know.
Okay.
Yeah.
Can I know your name, please?
Ghazwan. Ghazwan Ahmed. Ghazwan Ahmed.
Ghazwan. Mr. Ghazwan says that the doctor will prescribe based on the indication. How many of you know specialist doctors who go straight to the last line of treatment because they want to have a good reputation? Let me make that clear. Some treatments are very strong. You do not need to use them unless the patient is not responsive. Now, many doctors want to have a good reputation because they want the patient to be fixed after the first visit. Now, that's not always the case, but many doctors who have 70, 80 patients per day do actually go to the last line of treatment. Can I actually see a raise of hands as to how many people know a type of doctor like this? And how many of you will trust to take a family member of yours to this doctor? Okay, so can I actually hear from you for the reason? Please.
Hello. So actually, the idea is I wouldn't trust the doctor for for what he's doing. Actually, as you've mentioned, they should go through first line, second line, and then the last line. But if the doctor himself is good and he has good results with the patients, then I will have to take my family members to him.
Okay.
So that's the reason.
Can I know your background, actually?
I'm a junior house officer.
Sorry?
Junior house officer. I'm a doctor. Junior
Okay,
doctor.
you're
Yes.
a junior house officer.
Yeah.
Okay. So I'm sure you already know about the long-term implications of some drugs. I think that the most common example would be steroids. The long-term use of steroids, constant use of steroids, this will cause problems some years down the road. A very common example would be internists and steroids, actually. Internists use a lot of steroids. Aren't you worried that your family member or your relative will actually get sick in the future, 10 years from now, 15 years from now? Because I know you're a doctor, you can filter the process.
Yes.
But if you weren't, what will be your choice?
Yeah, if I wasn't a doctor, of course, I wouldn't have known that this would have happened to the patients, to my family members, I mean. So maybe I wouldn't, if I knew, I wouldn't have done that per se. But since I know that, for example, as a doctor, I trust the doctor's judgment on, for example, on treating that case specifically. If it's a younger age, for example, family member, of course I will not accept that on them. But let's say if it's a man in his 60s or 70s, then I would want the quickest treatment because, in geriatric age groups, sometimes their illnesses take a longer time to be treated. So the faster that they are cured from that disease, might be more beneficial for them. It's just a matter of psychological support for the elderly part of the family. While the younger ones, of course, I will not take them to a doctor that prescribes steroids.
Exactly, but again, you are a doctor,
Yeah.
so you know. But
Yeah, of
somebody who is not a doctor, somebody who doesn't know somebody who cannot ask another doctor because it's their relative, then that person has no other choice but to take the medication. And there is a reason we actually graduate doctors, and the reason is that we want these doctors to be trusted, and we want them to make the best decision for our family members when they need it. Now, the problem starts how ethical this doctor is. Now, because at the end of the road, pharmaceutical companies are a business. They will do whatever it takes to sell more. Some pharmaceutical companies even pay billions and billions of dollars so the name of their brand gets printed inside the guideline textbooks. We have many examples of that. So they will spend a lot of money for this. However, where can we filter this actually? Well, we can filter it through the doctors or through the pharmacists. How many people here are pharmacists? Okay. Now, as a pharmacist, usually we give whatever the doctor has prescribed. How many of you think that you are up to date with the newest guidelines for medications that are seen by the specialist doctor that's close to your pharmacy? How many of you actually constantly read up about this subject? I'm asking this because this is not common in pharmacists. So they do not know actually what they're doing most of the time. I mean, I'm sorry to say that, but I am a pharmacist and I know what's going on. Very, very few people are up to date. And these people usually do not work in pharmacies. These are the people giving trainings to medical representatives in the pharmaceutical companies. These people really know what's going on. And that's why they can train the med reps to do a great job at making the physician prescribe their medication. Now, there are many factors that the physician can choose as to why they are prescribing the medication, and pharmaceutical companies are brilliant in identifying those. You had something to say? Yes. Could we get the mic to her, please?
Thank you very much. I'm Dr. Ilaf. See, I believe there is a gap between the communication between the pharmacists and the doctors in our society. and this has made the role of the pharmacist less and the role of the doctor more, which has a disadvantage on both of them. The role of the pharmacist should be to help the doctor prescribe. For example, if we have any side effects, if we have drug interactions, this should be done by the pharmacist and not the doctor, because this will first take more of the doctor's energy to think about the drug as well as the disease, and it will take more from the job and the role of the pharmacist to, be in the health system. So I think there's a problem in the communication, there's a problem in the interaction. I don't know if this problem is generated from the doctors and the pharmacist itself or the system as a general, but I think there should be something that fixes this relationship and fixes the, let's say, job roles of both of them in the hospitals and in private clinics as well.
I think there is a reason that doctors are more dominant in the area, and that is because they are more up to date. Whenever it comes to a scientific discussion, from my experience, from what I have seen, pharmacists do not have the same amount of knowledge about drugs used in that line that the doctor has. I mean, unfortunately, it shouldn't be like that. But usually the specialist has more information. I would like to actually just change talking about the factors a bit to the financial side of it. Because doctors, there is a reason that doctors will do a lot of things for sponsorship. And that is doctors study many, many years and they do not get paid enough. How many of the doctors in this room, if you're working for the government, think that you have a good salary that is worth the 15, 20 years of studying that you have been through? I don't see any hands raised, which means that nobody thinks that they have a good salary. Now, I'm not saying that they should be paid a good salary by the government, but anywhere they're working, because their knowledge needs to be valued. Because if it isn't, then they will be pursuing other ways to justify their 15, 20 years of hard work in school. Now, the problem is that comes at a cost, and the cost is on the patient. I would like to actually tell you a few examples. I'm sure you all have these examples as well. One time, I saw a doctor, very good doctor, very reputable. People will say he's one of the best doctors in his line, prescribing omeprazole and pantoprazole together in the same prescription. Why? I know why, but the patient doesn't. Okay? Now, is this the doctor's fault? Well, I mean, it depends. It really depends. Maybe he didn't have enough information. Maybe he mixed up two brand names instead of writing the scientific name. That's why it got mixed up. However, whatever the reason, that doctor is overprescribing. Or maybe actually he needs some money or some support. I would like to think of it this way, that the major problem starts with the regulations set in place by each government and the national strategy for health by each government that will dictate what goes on inside the pharmaceutical market. Because we cannot just let this slide, of course, and pharmaceutical companies will continue on this path. I actually would like to hear how many of you have been in a situation where you have seen patient exploitation done by a colleague, but couldn't say anything about it because there is no guideline against it, there is no protocol against it. You have been in that situation. On a daily basis, right? So on a daily basis, physicians and pharmacists, I'm sure, witness this. But the thing is, they aren't always wrong. See, for example, a doctor can prescribe B-complex for whatever reason they do. They prescribe it, and that's a big problem. Now, that problem has a different side to it. It's a scientific problem, because many, many doctors will argue that the patient needs a vitamin B12 or a B-complex. Now, is this necessary? Well, it depends on the perspective of the doctor. And pharmaceutical companies know this. And since they know this, they know how to deal with this situation. Now, worldwide, there has been many trials as to how to control this. And in Kurdistan, there has been other trials as well. In Kurdistan, the government tried to stabilize the prices. So they say, okay, you're bringing in amoxiclav, you cannot sell it for more than this price. Now, the problem with this was, our government got their prices from Jordan and from Dubai. So they checked the prices in Jordan and Dubai and said, okay, you cannot sell it for more than this price. Well, the prices were too high because Jordan and Dubai, they actually have a better economy, and so the prices are much higher than here. So that didn't work. Another thing that was tried was to actually prevent counterfeit medicine inside the market by producing stickers. Again, that hasn't worked out very well so far because there is still counterfeit medicine. Now, a very good ethical dilemma would be actually, doctors, will you prescribe a brand company that you don't know is the original one or it's counterfeit? Or will you prescribe a generic company that you're not sure, again, how the quality is? Yes, please.
Okay, so I will talk about myself. Like on a daily basis, when I see patients, by the way, I have no shares with any pharmacies or anything like that, or any companies. But like, if I see a patient that I know that they're like wealthy enough or like can buy something good, I'm gonna prescribe the better company for that, like knowing that it is helpful. For example, like a German company is better than, for example, Iraqi or a Turkish company. So in such cases, sometimes like our hands are tied. You have to write the better medication for the patient.
How do you know it's better?
Because I've tried it on myself, for example. Like, let's say, for example...
Okay, you tried it yourself.
Yes.
You tried a brand company for yourself.
Yes.
It works very well.
Yes.
Okay?
Yes.
You write the same brand company, you give it to somebody, takes it to a pharmacy. The pharmacist either gives a counterfeit medication,
yes,
which could have been produced 2 or 3 years ago, packaging has been changed, it was under the sun, whatever, or the pharmacist changes it to a better company because the pharmacist is getting benefits from that company.
Yes. The thing is, for example, I've tried, let's say, both companies. So, like, I know, like, this is the better one in such cases. So, that's why, let's say, I write the specific company that I've tried on myself. And this doesn't make sense, for example, to try every medication on yourself to know that, oh, this is better, so I'm going to prescribe this one. But sometimes, like, you know from, like, your family members or, like, from friends that a certain company is better than the other one. So, if a friend or a colleague sees you that you write that specific company, they will be like, okay, maybe you have a share with that company. But they don't actually know the reality of it. Okay. So, like with a better, like stricter rules or like a better quality control of medications, I believe, if those counterfeit medications are like out of the market and you have, let's say, 3 or 4 good brands, like I think that will be like the best solution. Rather than, for example, writing a paracetamol that will not even work. Because like I know patients that
I would argue actually the opposite, that having 3 or 4 companies only would mean that there are companies who are monopolizing the market. It means it will increase the cost of the medication. So actually, if you are prescribing paracetamol, it's better if you have 100 companies in the market because that means they're competing on price. So it's less cost for the patient.
Yes.
However, the problem starts that you don't know the quality. So how do you actually balance these 2 problems?
That's where the government should like come in. Like for example, let's say, for example, if I was a government and I had
if you're the government.
Yes, and like I know, like 100% like came to give me like a specific company of paracetamol. I, for example, believe in 5 of them, and like the studies show that their product is good. So I'm just gonna let them monopolize the market, but like to a certain extent. For example, let's say a paracetamol would not be by 20K. Let's say maximum 7K or like 5K. Like there will be some sort of variety between the prices of these like 3 or 4 companies, but all of them are generally good, better than, for example, 500 dinar paracetamol. Like
I think there are a bunch of factors in that sequence that doesn't make total sense. One is that having a good competition in the market is better for patients because they will get better quality at lower cost.
Okay.
Now, the problem starts, actually the problem is much bigger than what I'm talking about. I think the problem is much bigger than this and many people aren't brave enough to actually talk about this. because it's not easy, really. And there are many people who have huge amounts of money in this market. So it's not about doctors. Yes, doctors make mistakes. Yes, doctors might get sponsored. They might agree with the pharmaceutical company. But we have problems on a much larger scale. For example, the physicians in this room will know that if you're working in a governmental hospital, that the drug you prescribe is not according to what you prescribe, it's according to what drug was brought into that hospital. And how was that drug brought into that hospital? Well, there are a bunch of scenarios. It's usually a tender, but again, doesn't mean that always the lowest price wins. There are many, many scenarios in this case, and if we can go even higher than that, we can actually talk about some counterfeit medication that cannot enter this country easily because there aren't enough patients. For example, if you talk about the anti-cancer medications, you cannot get a company to bring them because we don't have as many cancer patients. However, you still have some patients and they need treatment. So how do you actually change the model to make it that companies have to go through a good quality control system and doctors, hospital administrations, and people in power make sure that the quality of the drug and the mechanism it's used is in a way that actually benefits the patient instead of benefiting whoever is making the decision. So I think it's more complicated than that. Yes, please.
Greetings, everyone. This is Genia from Kurdistan Pharmaceutical Students Association, which is a part of International Pharmaceutical Students Federation. So I would like to ask two questions. I really want to observe the answers. The first one for you, doctor, as a pharmacist. So do you think that increasing the number of pharmaceutical companies...
Can you just repeat that, sorry?
Do you think that increasing the number of pharmaceutical companies will lead to an unsuitable dealing between the companies and the physicians? If yes, so what will be your suggestions? So also, my second question is for a physician here that would like to join me and answer me. How we can, or how you can, as a physician, make your own way to obtain that and believe your patients to certain of this treatment as a drug. I mean the drug and medications. So how? Thank you so much.
Okay, thank you. I personally suggest that increasing pharmaceutical companies or decreasing them will not affect the problems a lot, because the problems need to be addressed in different ways. In every developed country, they have a third-party organization. What do you mean by third party? It's not affiliated with anybody, neither with the pharmaceutical companies, nor with the doctors. Now here, the people who make the decisions will be the syndicates. Syndicate of physicians and syndicate of pharmacists. Now the problem is, the pharmacists want what's best for them, and the doctors want what's best for them. There is no third party. The third party is the government, but again, the government is either run by a physician or a pharmacist. So the decisions are made in favor of one of the sides. However, if you look at FDA, let's say, the Food and Drug Administration in the United States, it has nothing to do with anybody. That's why they can actually control the market. Now, this means that people in the FDA need to get paid well because they don't want to seek outside of the FDA. And at the same time, there needs to be laws that prohibit them from using the power they have in a manner that will hurt patients. Regarding your second question about the physicians, I think I can take the liberty to answer that, in that, yes, each physician can do their part. However, from creating a strategy, or from a strategy perspective, you cannot just trust that everyone will. Some physicians will just not. I remember one time a few years ago, I was visiting a doctor, a psychiatrist actually. Went in there, I was a medical representative at the time. And I went inside, there was a patient inside the room, and the doctor tells me, go to the toilet. What? He says, go to the toilet. Like, what should I do in the toilet? He says, I'll come there, just we'll talk. Leaves the patient, comes to the toilet, and asks me, tell the pharmacy I like this drug. I don't want anything for myself, just give extra bonus to the pharmacy. This is a doctor who has 50 patients per day. Okay? Which is another way of actually dealing with this situation. So certain doctors, I'm sure they can choose their own integrity and stop this. However, it means that they will make less money. Their friends will be driving in Range Rovers. They will still have a Camry, probably. But you cannot guarantee from a strategy point of view that everyone will. I think there was somebody who raised their hand. Yes.
Doctor, I would like to comment on what you said about the FDA being, they don't have salaries or anything.
No, I said they should get really high salaries.
Sorry, they have high salaries, but they work non-profitably. See, our country, the problem is with the political economy. We are not a capitalistic country, and we are also not a socialistic country. So there's a problem, there's a mismatch. Our health systems are free, but our drugs are not free. Our biggest hospital in Hawler, Rojhalat, which receives patients from all over the city and sometimes even from other cities, does not have certain major drugs. For example, we do not have omeprazole in it. Okay, we have to send the patient outside to get it from a private clinic. What's your suggestion? What should happen? Where is the problem? What's the deal with us lacking some major medications? And do you think drugs should always be cheap or always be expensive? And how should we regulate that with the free health system that we have, which takes about thousands of patients every day?
I think what people do not realize is that whether you like it or not, medicine and healthcare in every country is a business. So you need to buy at a certain cost and sell at a profit. Now, somebody has to pay for that. Either it's the government, or it's the insurance company, or it's the patient themselves. In many countries, it's the insurance company. Here, it's the government. So actually, the government pays a lot of money for these drugs. It's a lot of money that people get for free. And people don't value that. But is it a good system? Absolutely not. Actually, the doctor would just like to... here, please.
I'm sorry if what I say doesn't continue about with the previous, what was previously stated. I believe that the issue with the pharmaceutical branch that we have is on several different levels. So one of the levels is pharmaceutical complexes, medical complexes, in which there are more than 5 doctors, and they all have a part of what the pharmacy makes, so about 20 to 30%. This is where one of the problems arise, in which, as you previously said.
There is one thing that we cannot control that easily.
Yes, that is true.
And that's a small part of the problem.
Yes.
There is a much bigger part of the problem that has to do with national health strategy. That has to do with what strategies are put in place by committees and ministers inside the government to solve this.
Yes.
I mean, that is a problem, but again, it's a small part of the problem.
So I have a question from a different point of view. I think there was recently a suggestion through the government that doctors are only allowed to prescribe scientific names. So no company names, no brand names, only, for example, amoxiclav. I'm sure there are hundreds of brand names of different companies, but the doctor is only allowed to prescribe amoxiclav as a scientific name, and for the pharmacy to decide. Do you think that's
I think you cannot solve the problem like that.
Yes,
because
I agree.
You still have the problem, but you're shifting it from the doctor's side to the pharmacy side.
Yes.
Same problem exists. The pharmaceutical company, instead of sponsoring the doctor, they will sponsor the pharmacy. Because at that time, the pharmaceutical company will be the decision maker in which drug that patient will take.
I agree.
Yes, doctor, please.
Thank you again. I'm coming to this point that we are talking as if these problems are not capable of solving, like we cannot. They are very easily tackled with the NGOs. I have more than 8 years experience with the NGOs. It's basically very simple. You just have to have a good data. For example, in one of the primary healthcare, we had 5 doctors. When I was working with the MSF, one of the doctors was overprescribing. How we know? Because we had the data for the other 4 doctors that they were not prescribing that much. So we just contacted the doctor. Doctor, you are prescribing too much. He said, I'm a professor, how could you tell that? We said, we have a baseline to compare with. You said the government provides very much like high amounts of medications. I'm totally agree with you, but it's, I don't know if I can use this word, it's very haphazardly. For example, yes. You have a huge amount of some kind of medication that compared to omeprazole, as Doctora mentioned, it's not that urgent. I was working in Soran, we didn't have insulin syringe, which cost us like even $1 maybe. I worked there for 6 months, it was not available. At the same time, there was an ampoule, I don't remember the name. It's specific for hematology. It was tons there in the storage. So it's not regulating. They are like buying a lot of medication. There are a lot of NGOs donating, but it's not really regulated. It's totally haphazardly. Even we have some guys who are responsible for the units. When they ask for a specific kind of medication, and there is it has to be with some other medications because it's stayed in the storage for a long time. It will get expired. We have too much amoxicillin, too much paracetamol. You just have to take it. So I think the practical points that it just needs specific regulation from the government side, and this is the government. I'm not talking about the private. If we can solve at least this part, we have done a great job. Because again, I'm coming back to the first point. It's only misregulating. It's not lack of the medication, lack of the financial, because we have to use out most of our resources from human resources and from materialistic resources. So I think there are practical points that could be done easily, providing omeprazole, for example, or paracetamol for the emergencies.
I think you hit on a very, very important point, and that is that we do not have data. And the people who are responsible for buying these drugs and giving it to the hospitals, they do not understand the market. If we had data, we would know that how much of each drug is used, which doctor is using it. This is for the government, of course, for the governmental sector. And also at the same time, if the people who are responsible for the procurement of these drugs, if they knew about the market, if they were actually knowledgeable about the use of certain medications, I mean, how much amoxicillin do you need? But there are other drugs that are also important, and you need to have those as well. If there is a good risk assessment in these purchases, then it will make the life of patients easier. Now, on the other side, on the private sector, that cannot work as easily, because you cannot actually force them, since you have allowed them to open a clinic and open a pharmacy, and they are a business owner. Now, if they're a business owner, I'm sure you know the conflict between whether a specialist should see a patient or should a primary care physician see a patient and then refer it to a specialist. When for us at media, we have the second option. You see a primary care physician who refers you to a specialist if you need one. Now, in this case, the prices of seeing a specialist will increase. So you might pay 100,000 or 150,000 for seeing a specialist. But the thing is, 9 out of 10 times you visit a doctor, can be solved by a primary care physician. So in this case, we can solve it if we change the whole structure. So instead of actually letting a specialist be a business owner, which is not his job, we can change this system where there are multiple lines of physicians that see the patient or of health services that will help the patient and also decrease the cost of treatment. But again, since we are a developing country, the major issue in developing countries is that we do not have a certifying body. So you do not have an organization that's not affiliated with anyone and that has the power to tell you this is a good product or not. So for example, in the United States, if you see the label FDA approved, or in the EU, if you see the label TUV approved, you will know that this is a good product. However, here we do not have anything that certifies, okay, this is a good quality product. The government actually tried to expand the quality control services that we have here in Kurdistan for the drugs that come in, which is a very good thing. However, instead of upgrading the equipment and making the staff more knowledgeable, because you need these too, what was the mistake was this was not done, and instead, they forced every company to go through quality control, which means that the company buys the drugs, brings it here, and until it's approved from quality control, it takes 4 to 6 months. Some drugs will expire after 1 year. So you can see the waste that happens, and you can also see that many companies get discouraged from actually bringing good quality medication. Yes, please.
Thank you, doctor. Can we solve this problem, overcome this problem by using technology? For example, developing a decentralized app that every doctor and pharmacist and even some patients use it to rate that drug that they took it. For example, PPI, which brand is better, which company is better. And after years of using that program, we have lots of data, as Dr. Muhammad said, and we can certificate those drugs in Kurdistan and label those drugs provided by the data we gathered before.
I think, yes, of course, but the thing is, we don't have data. And getting the data is not as easy of a job that it sounds. It is not just people entering data. Yesterday, there was the workshop about if you cannot measure it, then you cannot fix it. And that is absolutely true. But the thing is, we don't have the culture of collecting data, and people don't understand what data even means, or what data analysis is.
If we develop an app, that will be easy. So you have to just choose it to rate it from 1 to 5, and you have stars. You have data for that.
Okay. That is one option. What you're talking about is a directory where people rate it, like restaurants, and same thing with the services.
Yeah.
That is one option, but again, you are not solving the bigger problem, which has to do with the government and regulations. The government has to allow for third-party organizations that are not affiliated with anybody. And also the government, for the governmental sector, has to intervene and put people in places where they actually understand the market and also understand the science, because they need both. I see a bunch of hands raised throughout the room. I'm getting told that we are finished and our time is up. So I'm sorry I cannot take it. Please feel free to talk to me afterwards or discuss anything you want. I'll be available. I hope we actually made some discussions that will lead to a productive outcome, and that certain people who are responsible might have actually listened to this and decide to go in that direction. I would like to thank you for attending. Thank you.